Our next speaker, I'm going to just briefly introduce her, is Allison Bartlett. She's joining us from the HDSA. She is a manager of the disability program and is an attorney who specializes in guiding people through um, conditions just like the Huntington's disease, and Social Security system. I know a lot of you guys have questions and issues. This comes up so often in our clinic visits, and I know Latrice Williams, our social worker, is trying to help field these questions, but they get complicated very quickly. And we do want to help you out. And I really am looking forward to this talk. We are really privileged and pleased to actually have Allison join us today to talk about some of these important questions and issues for our Huntington's disease families. So let me let her kind of get set up. And I think you're online. Feel free to go ahead and share your screen when you get a chance. And
does everything look good? And can everybody hear me okay?
Yeah, it looks great.
Okay. You know, my computer decides to do whatever it wants with my microphone, so I'm never quite sure. But I'm so happy to be here today, and thank you so much for the very kind introduction, Dr. McFarland. I've definitely helped a few HD families from your clinic, and I've really enjoyed working with your clinic and the quality of medical care that you guys provide. You guys do a wonderful job. Is it okay for me to, I'm gonna go ahead and start because I have a lot of information to talk about. The disability process is difficult. So today, my presentation is starting the disability application process. What I'm going to focus on today is Social Security disability. There are many kinds of disability. There's private disability, there's employer disability, and all of these things do work together. But my main focus for today, since we have a limited amount of time, is Social Security disability. So what I'm going to be talking about is, so Social Security disability actually has two different programs, SSDI versus SSI. So I'm going to do an overview of what those two different programs are. Starting the disability application process, I get this question a lot, like when's the right time to start the Social Security application and what to do while the application is pending. So first, there are two different kinds of Social Security benefits. There's Social Security Disability Insurance, SSDI, or Title II, and Supplemental Security Income, or SSI, otherwise known as Title IX. SSDI is the program you want to pay into. This is the work-based credit program that when you pay, like, so if you get a W-2 at the end of the year and you see that you're paying into Social Security and you know you're paying into Social Security retirement, you're also paying into Social Security disability. This is the program that you want to get disability from. One, because it's the more stable benefit program, and two, you're eligible for a lot more monthly benefits. The national average for SSDI is about $1,300 a month, but the most you can get with SSI is only $791 per month. I cannot tell you what you're going to get in your SSDI benefit. That is based on your personal work history and your account. A really easy way to check is to create a mysocialsecurity.gov account, and it'll tell you if you're eligible for retirement, if you're eligible for disability, and how much you're going to get per month. I have an account because I'm not going to tell people to do this if I don't have one myself. The last time I checked, I'm still not eligible for retirement because I haven't worked enough, but I'm eligible for disability, and it tells me exactly how much I'm going to get. And so that's just an easy thing to keep tabs on. With this program, it is really important though, like as soon as you have to stop working, you want to apply for Social Security disability because your credits do expire. So everyone earns a total of 4 work credits per year, and those credits do expire. Like just if you stop paying for your health insurance coverage will stop. If you stop paying for your car insurance coverage will stop. Well, when you stop working, you stop paying into the system, so your disability insurance coverage will stop. For most individuals, you have a 5-year grace period, but that's if you've had a very consistent work history and you're over the age of 40. If you're younger, the rules are a little bit different. You can find it online, or you can talk to me another time about it. But essentially, you have to meet the credit criteria. And so when you stop working because of your HD, you don't want to wait to apply for disability. One nice thing about SSDI is there is no resource limit requirement. They're only looking to see how much you actually are actively earning from working. So they don't care if you have a pension. They don't care if your spouse is a millionaire. It's based on your work credits and your work history. If you have stopped working because of your HD, you can apply for SSDI and you have the right number of work credits. And this program is also nice because you can get payments to dependents. So if you have children, your children could be eligible for benefits, your spouse could get some additional benefits. And if you support more than 50% of one of your parents, if you provide more than 50% of the support for a parent, your parent could also get additional benefits. So again, that's SSDI, the work-based credit program. SSI is the financial need-based program. So this is for individuals who don't have a work history, who haven't worked in a long time, for people who maybe were stay-at-home moms, or somebody who went to school and didn't work, and then possibly their HD started to impact them. So there's no earnings requirement, there's no work credit requirement, but there's very strict financial need requirement. So the monthly earnings I can't give you specifically because it's based on federal poverty level and how big your family is. So somebody who's just a single person, a family of one, their monthly earning limit or monthly resource limit is going to be lower than somebody who's a family of 6 and has 4 children. One thing that is consistent is individuals can't have more than $2,000 in resources or assets, and couples can't have more than $3,000 in assets or resources. This includes a checking account, a savings account, more than $1,500 in life insurance, or $1,500 set aside for burial, if you own more than 1 car, if you own any property other than the house you live in. So it requires you to have pretty much no resources, which is really hard. And there are no payments to dependents. So if you have children and you're only getting SSI, your children are not going to get additional benefits. So that's step 1, knowing the difference between the benefits. For a lot of people, it's mostly, there are only certain circumstances where you actually want to apply for both programs. Because if you know your SSDI amount is going to be more than $1,000 a month, you're not going to be eligible for SSI. The only time you'd want to apply for SSI and SSDI at the same time is if your SSDI amount is going to be less than $900 per month, or you're under the SSI resource limit and you could possibly get approved in less than 5 months, because there's always a 5-month waiting period for SSDI. There's no waiting period for SSI. So let's say you apply for SSDI and SSI the day after you stop working and you get approved in 2 months. You would still have 3 months to wait for benefits if you only apply for SSDI, but those 3 months in between, you could get SSI until your SSDI starts. Again, this is very complicated. Nothing about this is straightforward. I definitely am the obnoxious attorney when it comes to disability benefits, because my answer really is always, it depends. So if you have questions, please do not hesitate to contact me, and I will provide my information at the end of the presentation. Another thing to note with these 2 different benefit programs is they come with different kinds of insurance. SSDI, the work credit program, comes with Medicare. You are automatically enrolled in Medicare after 24 months of qualifying disability payments, so 2 years. The confusing thing about this is it's not based on the date you get your award letter, it's based on the date that Social Security finds you disabled. So let's say you submit a disability application today, which is February 25th, but you say that your disability started January 1st, 2021, and your application is approved in May. Social Security, the start date isn't May, the start date is January 1st, 2021, because that's when they said that you were disabled. It's not based on when your application's approved, it's based on the date they find you disabled, and then they count from that point. So again, if you're disabled as of January 1st, 2021, and Social Security agrees with that date, there's a 5-month waiting period. So your financial benefits would start in May, and then you'd have to wait 2 years from May of 2021. So then you'd be eligible for Medicare in May of 2023. You can choose to opt out of Medicare if you or your spouse has better health insurance coverage. But you do have to make sure you work with Medicare and the health insurance you are choosing to stay on meets their criteria, so you don't have to pay a penalty when you do ultimately enroll in Medicare. And then SSI comes with Medicaid. In the state of Florida, if you are approved for SSI, you will automatically be enrolled in Medicaid. Not every state is like that. Like, I live in the state of Virginia, and it's one of the only states that has their own SSI criteria. But in the state of Florida, if you're approved for SSI, you will be automatically enrolled in Medicaid. So that's not something additional you have to worry about. So starting the disability process. It's so important to prepare before you apply for disability. You can't wake up one morning and be like, oh, I'm going to apply for Social Security disability today. That is not how it works. It'll do you a great disservice to yourself and your application process and just everything if you don't plan out in advance. And the reason you want to prepare is because it can help expedite your case once you do apply. It can help you get approved. It can help you better understand and describe your symptoms and limitations of HD to Social Security, and it can help you advocate for your case with Social Security. So I'm going to say this, and it's really important. Social Security often doesn't understand Huntington's disease because it's very rare and it's not something they're familiar with. So in addition of proving that you have HD, you also have to show Social Security what HD is. It's not fair, but it is the burden that has been placed on the HD community. And if you don't know that going in, you're going to have a harder time getting approved for disability because it does require more work for HD families. HD does not count as, like, you do not get special treatment just because you have HD within the Social Security disability process. In a lot of cases, it's harder. And a really good tip is you should have copies of your medical records and know what is written in them. And I know that's easier said than done because of the nature of HD. Sometimes family members don't necessarily want to see what the HD impacted individual has in their medical records, but it's really good to have access to these things. And these days with patient portals, it's really easy to collect your medical records, and you want to have them. One, so you have them. Two, so you can submit them to Social Security directly and always have copies, because Social Security misplaces medical records or requests them from the wrong facilities sometimes. And I'll talk about that a little bit more later. So some common misconceptions when it comes to starting the disability process is you have to stop working to apply for disability. That is not true. You can technically work and apply for disability at the same time, but you have to be earning less than what Social Security defines as substantial gainful activity. So you have to be earning less than $1,310 per month. Now I'm second guessing that number. The number changes every year, so I apologize if it's not quite up to date. Like, it goes up slightly every year. I'm pretty sure this is correct for 2021. It's February, I don't know, I still get confused. I still confuse myself sometimes. But for now, we're saying that you have to earn less than $1,310 per month in 2021, and that's gross. That's before taxes. That is not the amount you see on your paycheck. Like, when you actually deposit it into your account, that's not the amount that's deposited into your account. That amount is usually after, like, taxes have been taken out and everything. You have to look at the tiny amount at the top of your paycheck before anything's taken out, and it has to be less than $1,310 per month. That is the amount the federal government has deemed that you have to earn that much per month in order to support yourself. If you're not making that much money, you're not supporting yourself. And if you're not making that much money, especially because of your HD, then you can definitely apply for disability. You do not have to wait to apply for disability. You do not have to be out of work for 3 months, 6 months, or a year. You can apply for disability as soon as you stop working or as soon as you're making less than $1,310 per month, as long as it's because of your HD. Social Security requires that you both are working less than this amount and you have a diagnosed medical condition. A gene test does not count. Having a positive gene test and a CAG repeat over 40 means nothing to Social Security. You have to have a clinical diagnosis, you need to have cognitive testing results, you need to have physical symptoms and limitations, or cognitive and behavioral symptoms and limitations. And never assume that this process will only take a few months. The national average for an initial decision is 6 months, but a decision could take more than 3 years. I have worked with many families where a decision has taken years. I worked with a family in Florida who it took us 11 years to get this person approved for disability. That was a worst case scenario, but don't assume that this is going to happen right away. Like, that's part of preparing. You need to financially prepare for this taking longer than you expected. And COVID has definitely slowed down the process. So Huntington's disease does qualify for something called compassionate allowance, which means The case should be expedited through the system. It should be looked at more often and should be always placed at the top of the list. But COVID has slowed everything down. So federal Social Security did not close because of COVID, but how it works is when you submit a disability application, you submit it through your field office, which is federal Social Security. And then once they've determined that you meet the financial criteria, the work criteria, you have enough work credits, they send your case to Disability Determination Services. In the state of Florida, that's through the Florida Health and Human Services Department. They may have shut down during COVID, so they could have a backlog. And so this could definitely take longer than the 6 months that it used to. It's really hard to predict at this point, but I just wanted to let everybody know it could definitely take longer now than it has in the past. And so everyone knows, there's no standard timeline for applying for disability. You must determine what works best for you. This is definitely a very personal decision. And it's a conversation I'm happy to have with families to talk you through it and make you understand what's best for you. But there is no golden rule. It depends on your circumstances, your employer, your boss, your accommodations, and your symptoms and limitations. And again, you can definitely continue working while your application is pending if you meet certain criteria. So what are the first steps to starting the disability process? Well, one, I think it's really important that you familiarize yourself with Social Security's disability rules and regulations. So Social Security has a specific listing for Huntington's disease. It's listing 11.17. And this defines exactly how Social Security is going to look at a Huntington's disease case. They want to see that you have physical symptoms and limitations. It's still a little outdated because they really still want to see that you have physical symptoms and limitations, and that's not accurate for everybody. So if you're someone who doesn't have physical symptoms and limitations, that's not a barrier to getting Social Security disability. There's also a listing 12.02, which is for neurocognitive decline, which is also a really appropriate listing for Huntington's disease. And it looks at language, executive function, social abilities, and a few other categories I can't remember off the top of my head, but essentially what you have to show is that your symptoms and your diagnosis causes marked limitations, either understanding, remembering, or applying information, interacting with others, concentrating, persisting, or maintaining pace, or adapting and managing yourself. And I'll go over this more in a little bit. You want to make sure you're familiar with compassionate allowance because HD is a compassionate allowance condition, which again means that your case should take priority and should be expedited through the system. You have to ask for compassionate allowance. Do not assume Social Security will flag your case correctly. The other thing, Social Security is bad with the alphabet, and Huntington's disease is actually listed under A. It's under adult onset Huntington's disease because they treat juvenile onset Huntington's disease differently. So juvenile onset Huntington's disease is under J, and adult HD is adult onset Huntington's disease. So when you submit an application, you want to call it adult onset Huntington's disease. You also want to understand the application process. So again, when you apply, it goes first to your field office. They make sure you meet the technical criteria. So again, work earnings, work credits, financial limitations, those things. And if you meet the technical criteria, then your case goes to Disability Determination Services, where they look at the medical aspects of your case. If you, for some reason, get a technical denial, like you're making too much money, you don't have enough work credits, your finances don't meet the resource limits, they never even looked at the medical component of your case. So they never even looked at the fact that you had HD. They just looked at the technical aspect of your case. So it's important to know the difference because sometimes with a technical denial, it's not worth appealing. So it depends on the denial. You want to understand your symptoms and limitations. This is so important because Social Security is judging you based on pieces of paper. They're most likely never going to see you. They're most likely never going to verbally hear your story. They're going to judge you based on your medical records and what is in your, what information you put in your application. So the more information you include, the better. And you also want to know what evidence to gather and where to get this from. So here's listing 11.17 for Huntington's disease written out. One nice thing is I have created a resource, and it's on HDSA's disability page that explains what Social Security is looking for when it comes to understanding, remembering, or applying information, interacting with others, concentrating, persisting, and maintaining pace, or adapting and managing oneself. don't have to guess what those terms mean. Social Security has defined it, and I have made it into an easy resource. So you guys can easily see they give examples. They give examples in a work setting, but they would easily translate to a life setting as well. The Social Security doesn't just want to see how this impacts you at work. They want to see how it impacts your activities of daily living. So you need to include both of those things. And again, if you just say, I have memory loss and difficulty concentrating, and I don't get along well with others now, that doesn't mean anything to Social Security. How does your memory loss impact you? What kind of memory loss? Do you have short-term memory loss, intermediate memory loss, long-term memory loss? Can I tell you my name and you'll forget it 5 minutes later and never remember it again, but you remember things from 20 years ago? Okay. That means that you would have a really hard time learning a new job because you wouldn't be able to remember the new tasks. Like difficulty interacting with others. Is it because you have extreme anxiety now? Is it because you get really irritable? Like, you have to be very, very explicit and clear about what you're experiencing in a disability application so Social Security understands. So gathering evidence. What kind of evidence do you need to gather? You definitely need medical evidence. You need evidence of your activities of daily living. It can be beneficial to have employment records if you started to have difficulty at work. So if you started having difficulty performing your job, or you got written up, or if your job was awesome and provided you accommodations to help you do your job as long as possible. And for education records, that's more for if you're a younger individual, let's say you're under the age of 25, or if you were recently in college. So education records usually aren't as important if you're older when you're applying, but if you're younger or were recently in school, education records can be really helpful for the process because they also tell an important part of the story. So where do you get this evidence? You get it from doctors, therapists, employers, friends, and family. So doctors, clearly you would get it from like Dr. McFarland or Dr. Clausen. So you want to get it from your neurologist. You definitely need medical records from your neurologist. You need, if you're seeing a psychiatrist, you definitely need records from your psychiatrist. If you go to occupational or physical therapy, you need those records. If you go to speech therapy, you need those records. Again, employers, especially if you were written up. If you never confided in your employer and there's no evidence that you were like written anywhere that you were having trouble at work, then you don't necessarily need to get evidence from employers. It's not always easy or straightforward to get evidence from your employers because some of them are like, oh, what do you mean you're filing for disability? I don't want to be attached to this. That's okay. You don't have to get employer information from your employer. Just get it if you have it, or you have access to it, or your employer is willing to help you. And I always tell everyone to get letters from friends and family. Why? Because of the nature of HD. It is something, if you have HD, you live with it every day. It is your new normal. And so you may not notice little changes that have happened over the weeks, months, or years because sometimes things change so slightly. But your friends and family have an easier time seeing those changes, and they can see things in you that you may not see in yourself. And I say no one should ever have to do this alone. You definitely want someone who's helping you through the application process, especially if you're the one with HD, because this is a complicated process. And especially if you have cognitive symptoms, expecting somebody who has cognitive symptoms and limitations to complete this complex process alone is like asking a pitcher who broke their arm to go out and pitch the next day. It's not a reasonable expectation. And so I don't expect anyone to do this alone. I think it's really beneficial to have help from friends, family, social workers, and your medical team. And so how do you gather this evidence? Definitely get medical records. I always recommend getting a medical record, medical letters from your doctor because they can add additional information that tells more of a story. Medical records usually only tell one part of the story because your doctor doesn't see you every day. It doesn't necessarily include like your activities of day-to-day living or how you struggled with work. But sometimes if like you talk to your doctor more, they could write a letter that explains in a little bit more detail how these things impact you more directly. Getting letters from friends, families, and employers, and always including your personal experience. I highly recommend starting to keep a journal before you apply for disability so you can track your symptoms and limitations, so you can track your good days and your bad days. Because when you submit a disability application, you want to do it from the perspective of from a bad day. It's not about what you can do, it's about what you can't do. So this is a really unpleasant experience. It's like you kind of have to you have to take a step back and think, how am I really impacted? How has this changed my life? How has this impacted me day to day? How does this impact my ability to work so I can't work anymore? You do not want to put on a good face for Social Security. They're the last person you ever want to put on a good face for because then you're sending the wrong message. So medical care, talked about that a lot today. Medical care is so important just in general for HD, but for the for the disability process, because you cannot be found disabled if you don't have a clinical diagnosis in your medical records. If you do not have medical records or proof of your HD, you will never be found disabled from Social Security disability because it is a legal proceeding. Federal laws dictate how you are found disabled through the Social Security disability process. It's like any other legal proceeding. If you don't have evidence, you can't be found innocent or guilty. You're just in limbo, and this works the same way. So you need to see your physicians on a regular basis. You need to get treatment from a relevant specialist. It's important to collect business cards for each of them, because you're going to have to put their information in your application. And you definitely want to follow prescribed treatments. There's more flexibility with HD because there is no cure, because there's no there's no magical medication at this time. There are other conditions where that's the case, but with HD, there's a lot more flexibility. You want to be mindful and honest in speaking to your physician. Do not undermine or discount your symptoms. If you're not great about talking to your doctor the day of your appointments, bring a family member with you. Journal. Write notes down, ask questions, like write down questions and things in advance. I know I'm not great about it. When a doctor asks me, how are you doing? My standard answer is always, I'm fine, even if I'm not fine, because that's the kind of question and answer response we have in our society. You don't want to answer I'm fine if you're not fine, because that gets into the medical records. It adds bias to your medical records. And if that's what Social Security reads, that's what they're going to take at face value. If you say you're fine and you're not, they're going to be like, okay, they're fine. I'm not going to dig deeper. Like, why am I here? Why am I going to approve this application if they're like, I'm fine, I can do whatever I want. So don't do that. And again, benefits of journaling: track good days and bad days, track your symptoms, track any side effects of your medication, because Social Security takes those very seriously, track your activities of daily living and your limitations due to your symptoms. So where can you get medical records from? From doctors and hospital facilities like University of Florida. Because there's difference between like standalone doctor's offices and like medical health systems. Like to get records from Dr. McFarland, you'd have to go through the University of Florida healthcare system, which is fine. And if it means you have other doctors that you see within that system, you could get everything at once. But again, you want to get your neurology records. You want to get records from your primary care physician, from a psychiatrist or a psychologist, physical therapy, occupational therapy, everybody. And if you've been diagnosed with things other than Huntington's disease, you want to get medical records for that too, because Social Security is looking at the combination of your impairments. There are some conditions you may have with HD, especially like depression and anxiety. You can't always tell what condition is causing the limitation or the symptom. You don't have to know. You just have to say, like, these are all my conditions. I don't know what causes what. I just know this is how everything impacts me. And Social Security has to look at all of that in totality. If you've ever been to prison or other correctional facilities and they have medical records, you want those. Welfare agencies may have records of yours that may be helpful, and insurance companies who have paid disability benefits. So if you get long-term insurance through your employer and you had to submit medical records to them, it might be easy to just request everything from them because they already have it. Again, medical letters. And to be clear, the letter needs to specify your symptoms and limitations and how they prevent you from working. Your doctor stating you are disabled without proof is not enough, and Social Security does not like it. You know who gets yelled at? Your attorney. You know how many times I've been yelled at by a judge because they're like, the doctor doesn't get to decide who's disabled. I do. And I'm like, it's not me. But so if you are going to get a letter from your doctor, there is a sample letter that I worked with Dr. Martha Nance to create, that is on HDSA's website. That's a really good template and starting point, because you really do have to prove in the letter why your patient is disabled. It's not just like they're disabled because I said so. They're disabled because they have these symptoms from HD, and these symptoms have caused these limitations which have impacted these areas. That's really, really helpful and can change the outcome of the case. Again, obtaining medical records in this day and age is a lot easier because you can get them directly through your patient portal. So you can download them directly, or if for some reason your medical patient portal doesn't include every aspect of your medical record note, you can request records directly through your patient portal, normally at no cost. You can always ask your doctor or social worker for copies of your medical records or how they can help you obtain them. And you can go directly through the medical record department at the hospital or facility. Usually you can email or fax a request. Most hospitals make you fill out their medical release form, which has all the information on it that you need to request your records properly. And I have just included this slide to show what Social Security is looking for when they're looking at an HD claim. So they want to see documented progression of motor, cognitive, and psychiatric symptoms. They can see a family history of HD and an abnormal neurological exam, findings consistent with HD. Again, like you can submit your gene test, but just having a gene test alone is not enough. I don't recommend submitting brain imaging because most Social Security physicians or consultants don't know enough about HD to know that some like MRI testing can be irrelevant depending on when it's done. But psychological or psychiatric reports, including neurocognitive testing. Neurocognitive testing is so important for a disability claim, and it helps substantially because most neurocognitive testing is fairly similar across the board, and it uses easier to understand standards that Social Security understands because they don't recognize the Unified Huntington's Disease Rating Scale as an acceptable test because only HD uses it. MOCA results can have mixed reviews because if you don't include the actual piece of paper test in the patient's medical records, then they're not going to use that MOCA test result because it doesn't mean anything to them. Or if you don't explain like this person has a 21 out of 30, well, what does that mean? But if you see in bold, it says diagnosis of HD or laboratory testing results alone do not meet listing severity. I'm going to keep saying this over and over again until the HD community as a whole knows this, because I don't want anybody to get approved anymore because they think HD's gonna magically get approved, get them a magical approval based on a gene test alone. It's not. It's just gonna lead to heartbreak and denials. What are activities of daily living? They are routine activities people do every day without assistance. So eating, getting dressed, going to the bathroom, bathing, showering, toileting, and transferring positions. And then there's instrumental activities of daily living, which is your ability to live independently and thrive. So companionship and mental support, transportation and shopping, planning, meal preparation, managing your household, things like that. Social Security looks at all of this stuff when they're analyzing a disability claim, which is why it's so important to talk about. So how do you gather this evidence? Keep a journal to track your symptoms and limitations. Again, describe your bad days, include all changes and accommodations. It's okay for you to write a letter to Social Security. There's not a lot of room in a disability application to really talk about what you're going through. So you can submit an additional letter written by yourself to Social Security, giving even more detail. Like they want to know how HD has impacted your life. And writing the letter in advance gives you time to think about what to include. And if you want, you can have like a friend or family member read over the letter to make sure it really includes everything you want it to include. And again, getting letters from friends and family. The letters should come from people who know you best. And it's good for them to include a timeline with dates of how HD has impacted your life and how it's changed over time. Because again, Social Security wants to see that progression. So what to include in the application? You want to say, I should be found disabled per listing 11.17 for adult onset Huntington's disease. Include your symptoms and include limitations caused by these symptoms. You want to say my claim should be flagged for compassionate allowance. The DI 23022.923 is literally Social Security's internal code for why HD should be flagged for compassionate allowance. Throw every little bit of information at them. The application asks general information, like if you've been married, if you've had any prior marriages and your children. It'll ask for your spouse's name, their date of birth and Social Security number, and ex-spouse's information, so make sure you have that. It will ask for date and location of marriage and divorce. They want to see your past 15 years of work history, especially if you're 40 or older. You'll generally only need the name and address of your employer for your most recent employer, but you will need job details like what you did. It's good to include your actual job title, and you're gonna, like, if you have a resume, submit that with your application because Social Security wants to see exactly what you did when you applied, like while you were working at that job, because they're going to look at all of your past jobs to see if you can still do them, and also include dates of employment. You need to include months and years. Social Security does not just accept years. If you can't remember, best guess, that's fine. You're going to need your total earnings for the past 2 years, all physical and mental conditions. So again, if you have more than just HD, like if you have depression, anxiety, chronic back pain, things that like don't seem related, but you have been diagnosed with, include them. And again, include all of your doctors, include all of their contact information, their phone, address, fax number, the first appointment you had with them. Again, you can use your best guess, but definitely be accurate with your last appointment and any upcoming appointments, and then medical tests and medications. What to submit with the application. So definitely your personal records, your medical evidence, medical records, medical letters from your doctors, employment records, education records, activities of daily living in the form of letters, earnings and pay stubs if you are still working, a resume, because it says a lot of work information, and then some additional forms that can be really beneficial. So if you are the family member helping somebody complete a disability application, I 100% recommend submitting an SSA 1696 appointment of representative form. You are allowed to be a representative as a family member, and this gives you the legal right to talk to Social Security and for Social Security to answer you back. You have no legal right to somebody else's disability application if you don't have a 1696. Even if you have power of attorney documentation, you have no legal right to the application. Social Security only recognizes guardianship and conservatorship. And something else that you might have to submit if you are actively working while the application is pending is something called a work activity report. The best practices: do not undermine your symptoms and limitations. Do not make it seem you are better than you are. This is how you get denied. This is how it takes years to go through the disability process. And so if your loved one with HD has anosognosia, or really they lack insight or judgment, then you need to do the application for them, because they're never going to be able to do the job and answer the questions honestly, because they can't see, they don't know, it's not their fault. Ask for help if you need help. This is not something that should be completed alone. Ask questions if you have questions. That is why my job now exists, so I can answer your questions, because Social Security actually often answers HD related questions wrong. Work with your doctors and social workers throughout this process. Keep them informed. Tell them you're applying for disability. Tell them when you're thinking about applying for disability so they can help you prepare. Like, some doctors change what they put in their medical record notes, or say like they're thinking about starting to apply for disability because they've started having issues at work. Like, all of that stuff is relevant. Track all of your doctor's appointments and contact information. Keep an up-to-date list of your medications and why you take them. And follow up with Social Security regularly once you have submitted your application. Confirm your application has been received. Confirm when your application is sent from the field office to Disability Determination Services, and confirm that Social Security gets your medical records, especially your HD medical records. Legally, Social Security has to request your records. If we look up the definition of request in the dictionary, does it mean obtain? Does it mean receive? It does not. So Social Security legally has to request your records. It does not mean they will receive them. Stuff happens. Medical record departments can be annoying. I hate them so much. So that's why I always tell everyone to submit their medical records, because that is how you guarantee Social Security gets what they need. If Social Security requests your records a certain number of times and doesn't receive them for whatever reason, they have to make a decision in your case whether they have your medical records or not, because they did their legal responsibility. They requested them. They don't have to receive them. And what to do while your application is pending. Again, follow up with Social Security. When you first submit the application, follow up within a week. And then I say follow up about once a month. Social Security is never going to follow up with you or give you an update. That is your responsibility. Continue to get medical treatment. Contact Social Security if you have any appointments while your claim is pending, or let's say you're driving and you get in an accident that could be HD related. That's not something you would have put in your application because it was spontaneous and not planned. Call them and tell them that it happened so they can get the record, because again, you want them to have the whole picture. Complete any and all forms. Social Security sends you, do this in a timely fashion. Pay attention to deadlines. If for some reason you have to go past the deadline, these forms usually come with a phone number. Call the phone number and say, like, this happened. Like, it's due tomorrow. I got it in the mail yesterday. Can I have an extension? I'm actively working on it. they're going to give you the extension because you're clearly trying. Provide as much detail as possible. Social Security's forms are not, they're terrible. They're terribly written. I hate them so much. But I say it like that because it can make it hard to do a good job of answering the questions because of the way they are asked. If you have questions, call me. Or if your answer is not going to fit in the tiny little itty bitty box that they provide, add an entire another sheet of paper. Do not be limited just because the form tries to limit you. Use as many words as it takes to describe what's going on. And always call Social Security if you have questions. Do not be afraid to contact them with questions. And if for any reason you're asked to attend a Social Security doctor's appointment, these are called consultative exams, go. In my professional experience, like 95% of HD families are sent to a consultative exam because Social Security has weird rules. They need to see that you've gone to the doctors in the last 3 months, and a lot of times they have issues with whatever cognitive tests are in your medical records. They don't have enough cognitive tests. So a lot of time they send HD individuals to get more cognitive testing done. That's never an issue because if you really do have HD and it's impacting you cognitively, you're not going to do great on these tests. And don't try to do well on the test. Like, don't try to fail. Perform as you should perform, but again, never try to do better than you are, but also don't try to purposely fail. But you have to go to these appointments. If you are scheduled for a Social Security doctor's appointment and you don't go, they're scheduling you because they think there's not enough information or evidence in your claim. So if you don't go, they're likely going to deny you because you didn't cooperate, and you don't want that to happen either. Okay, are there any questions? Sorry, I talked too much. It's okay. We can hold all my questions to the end. But this is how you guys can contact me. I am always open to be contacted by family, by social workers. I am here to consult with the community and be a resource whenever possible. That is why I have the job that I do. And also, just as a general reminder, HDSA is a volunteer-based community, and we are definitely looking for more volunteers in Florida. So if you're interested in volunteering, email Melissa Wind at mwind, like the wind, W-I-N-D, at hdsa.org. Okay. Thank you, guys.
Thank you, Allison. Does anyone have any questions for Allison? I don't think I see any in the chat. If not, I have a couple questions for you. So I'm one of the physicians taking care of HD at our center too. And sometimes patients come back and share with us, that their disability application was denied, and they share with us the reasons for that. And several times I've gotten patients who have said that they were told that they were denied because they didn't have neuropsych testing. But as you can imagine, if somebody is disabled and not earning any income, and maybe they haven't qualified for any type of insurance, neuropsych testing can be quite expensive. So from listening to your talk, it sounds like maybe if they would meet the disability criteria based on motor symptoms, it would not necessarily be necessary for their application. But if cognitive symptoms are a large part of it, then of course it's required. Is that right? So
neuropsych testing is not required. Also, I'm not trying to be statist. Florida has been at the top of my list, and not in a good way. I remember having representing a patient from your clinic who clearly should have been approved at the initial application stage, and the person kept getting denied. They denied at initial application stage. We appealed, denied at the appeal stage. We get to hearing stage. A judge we request compassionate allowance, don't have to go to hearing. A judge reads through this person's case within 3 months of getting to hearing, and the judge is like, why are we here? Please give this person disability and go away. And so I have issues with the way the state of Florida does an analysis. That unfortunately is something at the federal level that we cannot change. And so, yeah, in a perfect world, everyone would get neuropsych testing, but I think other ways to help, again, like medical letter from your clinic, because that can give more clear details about what's going on. I don't know how you guys do, I don't remember how you do your medical record notes. It's been a few years. If you do MOCA testing, are you allowed to include the actual MOCA test in the results? Can you include the explanation of what this score means? Because you guys, if I remember correctly, your clinic does a really good job of notating a lot of things. And I loved your medical record notes. I'm a weird person.
We're able to scan all of that into the medical record. So it's a little bit in a separate spot. So it might take digging if someone didn't know it was there, but but yeah, we know we do scan all that. The other thing is that I've been told by patients that if they haven't actually had their genetic test result, that they're automatically denied for a Huntington's diagnosis.
No, you do not need a gene test to be approved for Social Security disability. I know this from firsthand experience. Again, it's all about the clinical diagnosis. Like, it's all about the clinical diagnosis. And so this, again, this could also be like, because when this happens, I'm sure you guys haven't seen what the patient actually put in their application. We don't know how they describe their Huntington's disease.
Mm-hmm.
We don't know how they describe their symptoms and limitations, because Social Security has an extra high burden for families with HD because they don't understand what the disease is. And so some of the resources that I have created and are on HDSA's website are also ways to describe your HD in your application. Like, it is really important to say HD is like Alzheimer's, Parkinson's, and ALS combined. I have like little paragraphs that can be included in the application to help describe what it is, because Social Security has a hard time understanding what it is. And I think having, like, it's an unfair burden, but the more information that's also included about Huntington's disease does help the process.
May I have a quick question for you? I guess first I would just say that you are a gem to the HD community. I'm so glad we find you and have you. My quick question is really this is an overwhelming process, hugely overwhelming. And when I think of my HD patients, I know this is even more overwhelming. It's overwhelming me as a physician. So do you have some, I know other than reaching out to you, do you have any resources that we can tell our patients as to, maybe people who can guide them through the process? Besides that, we have our wonderful social workers who help out. They're great, and I'm going to hear from Latrice here in a minute, but are there any community resources, maybe in Florida, that we could point to who could help patients go through this, who kind of navigate the process a bit? Because I think this would just getting the records is not always obvious, even though it sounds like it's simple to us. So just an example.
So I know there are organizations, I cannot necessarily personally vet them. Like, there's an organization called AllsUp that they do look at your case. They want to get information from you about like your diagnosis and kind of like your medical history and where you are in the process. And they have like a little quiz thing that I think you can take to see if like they're willing to take on your case. They are a service that does cost money. Like, so with disability stuff, the cost is never upfront. It's always based on your back pay. Like, legally, if someone is going to represent you in a Social Security disability claim, they cannot charge you upfront. They can only get a portion of your back pay. And so families shouldn't necessarily worry about the cost, because it ultimately means they get disability a lot faster, and it just means a slightly reduced back pay, which, like, it's not taking out something from their pocket now. It's like, it's going to reduce the lump sum payment they get in the future, but it's not something that's coming out of their pocket now. I don't have I don't have any attorney referrals in Florida, unfortunately. There are a few organizations. There's NASR, which is the National Organization for Social Security Claimant Representatives. They have a lawyer referral service where you can access that information. Again, AllsUp, they specialize in really starting at the initial application process. I can send some follow-up resources like as I come up with them to you guys, just so you can share them with the community. I don't have things off the top of my head. This is just really hard because there are definitely disability attorneys in Florida. Do they specialize in HD? No. Is it hard to find an attorney that specializes? Like, it doesn't necessarily have to be someone who specializes in HD, but it's someone you want to have specialized in at least like Parkinson's or ALS or Alzheimer's or some kind of cognitive neurodegenerative condition. So they also understand how to work with the families, because a lot of times lawyers don't necessarily how to work with these families either. And that's a really important part of the process. I am working on trying to find an attorney network, but I haven't been here long enough. It's been like a year and a half. So it's a work in progress, but there are some resources out there. I can't vet all of them, but it's better to have those and at least have a starting point, because this process is complicated. I like to say Social Security has this really complex game of Monopoly, and only they have the rules. And I've tried to lay out the rules for everybody. So definitely go to HDSA's disability webpage because I do have a lot of resources there. I've created a disability booklet that talks about the Social Security disability process and a number of different resources, like you have to say what date your disability started. I have created a worksheet to help you figure out your onset date. I have a guide for completing the online application if you've been denied. I'm working on the initial application. So like there's definitely a lot of good resources as starting points, because I think a lot of HD families are better equipped to do this on their own because you know HD best. You can tell your HD story better than anybody else. There are definitely circumstances where you want help, but I think it's good to start with the resources so you can figure out what you're comfortable with. And then if you're not comfortable doing it on your own, then you go to the next step of finding more assistance.